Hello everybody and welcome to Coastal Experts. Today I have with me Dr. Tim Curran, who is a doctor of clinical psychology with Horizon Behavioral Health. Hi Dr. Curran, it's great to see you again.
Hey Natalie, good to see you.
So today we're talking about psychoeducational testing. Can you define that for me?
So psychoeducational testing is what is done in order to identify specific problems that a child may be experiencing in school. So we're looking at things that are contributing to specific deficits in certain academic areas, and this may be as a result of things that are going on at the home. It could be deficits in particular cognitive abilities, looking at different areas of academic functioning, whether they're performing at a level that is consistent with other children their age. We're also looking at maybe behavioral problems that may be contributing to some of the problems that they're experiencing as well.
It does sound like a comprehensive test. Now, who can conduct this type of testing?
Okay, so when these assessments, they can be done in the schools by school psychologists. Also, there are some educational specialists that can do these assessments, but generally they're done by psychologists or licensed psychologists. Now, in terms of actually administering some of the testing, these can be administered by master's level clinicians, but they need to be overseen by somebody who is licensed in psychology or a licensed psychologist.
So let's talk about some of the benefits of the testing.
Yeah, so we want to be able to identify the weaknesses that we can target for interventions, looking at those areas that they may not be performing as well compared to others. In order, there's specific things that we can do to try to enhance those deficits. Also, ruling out any kind of specific learning disabilities that may be contributing to the problem. By identifying those, if there is a specific learning disability, we can provide accommodations within the schools and giving them the ability to perform at a level that is more consistent with their ability. Once the evaluation is able to identify some of the difficulties that they may be experiencing, or if there is a diagnosable condition, they can take the evaluations into the school in order to develop either a 504 plan or an individual educational plan or an IEP. There's differences in there where a 504 plan may be accommodations that they're given which are implemented by the teacher, and there may be some leeway in what they can provide and what they won't provide, whereas an individual educational plan or an IEP is a federal plan that they are required by law to accommodate, and these accommodations are often provided by specialists within the school that are specifically trained in providing these accommodations, and they're required by federal law in order to provide these things.
So, Dr. Curran, if a problem is identified, is there a need for further testing?
Well, the testing is going to be valid for a period of about 5 years. Beyond that, some of the reasons that you'd want to get retested were to determine whether or not some of the interventions that were done had an effect, and seeing if there's maybe some elevations in the areas that were previously weaknesses. Also, later in life, they might want to get reevaluated in order to be able to qualify for accommodations on certain standardized tests like the SATs or the GREs or things like that. And also, going into college, usually the Georgia Board of Regents needs an updated testing profile. Okay,
so you mentioned accommodations. What if the students feel they're getting special treatment?
Yeah, so that's something that's commonly seen. Students will receive accommodations as a result of some of these evaluations that are done, and they won't take advantage of their accommodations because they feel like they're getting some type of special treatment. Now, this isn't the case at all. They're not receiving any kind of special treatment, and if you think about it, if all of the students were experiencing the same deficits that they are, the classrooms would be set up vastly differently than they are.
Right.
And these things would already be incorporated into the classroom. But because it's not the average way of functioning, they're tailored more to basically the average student. Now, by not taking advantage of these accommodations, they're not going to be able to achieve their full potential. they're having to work much harder than an average student, and that shouldn't be the case, and that's not what they're trying to test, in school. They're trying to get them to learn the material and learn these topics and test them on their ability to retain these topics. And if they're struggling with just the format of how the test is given, well, that's not an accurate representation of their functioning or their ability, and it can limit them.
So, Dr. Curran, what I'm hearing is psychoeducational testing is so important, and it can really make a difference in an individual's life. And this is something that is done at Horizon Behavioral Health.
Oh, yeah.
Thank you, Dr. Curran, for all of your work and for joining us today.
Well, thank you, Natalie.
If you'd like more information on psychoeducational testing, or you have questions for Dr. Curran or any of our Coastal experts, all you have to do is go to our Coastal Experts page. You'll find that at wsav.com.